You have a plaque upstairs that said, 100 years from now, it might not matter what kind of clothes you wore, what kind of car you drove, or what kind of home you lived in. What will matter is if you made a difference in the life of one child. That's Providence House.
It's extremely important to help other families remain strong because our whole society is based on that.
They reach out to the kids, the parents, and the community to make them whole again.
Providence House has grown tremendously in the 30 years that we've been here. We've always provided wonderful, loving care for children while they live with us here. What's changed the most, though, is the engagement of the family. It's easy to say we can prevent child abuse and neglect when children live here in our house, but the real challenge is, can we prevent it when they go back home? So we began to work very, very intensively with families through education and mentoring and visitation programs and community service linkage and managing all of that here as an advocate for the child. That's where some of our most important work goes on.
Providence House is important to us as police officers, first responders, because we need to have something quick that we can rely on. Providence House is always available, and we know that we have confidence that it's a safe place for the kids to go.
If there were no Providence House, for Rainbow, we would not have the same ability to send families to a situation that everyone would feel comfortable.
There could be a number of situations that the kids are brought to our attention. Their parents could be ill and taken by emergency medical service to the hospital. They could be car accidents.
We've heard stories about kids who are in a waiting room at an emergency room and the parent needs to go in and there isn't anybody to call.
My health was a big concern for me. I was back and forth in and out of the hospital.
Taisha came to Providence House after she was diagnosed with cancer, and she was unable to maintain her medical treatments because she had no one to care for her little girls.
You stress a lot about a lot of things when you're in a situation like that. I was just really determined on getting them in a safe place and taking care of the business I needed to take care of.
Mothers feel very confident when they leave their children here. There's a tremendous trust between Providence House and the mothers who bring their children here, that they will be safe and that they will be well cared for. And they avoid entrance into a very complex system called child welfare.
And thankfully I didn't have to go through foster care and all of that. You know, my kids are with me where they're supposed to be.
It's an organization that has such ripple effects throughout the entire community of really saving a number of families who really just need a short period of time while the parent is able to take care of themselves and get well and be able to thrive and be reunited.
My kids are doing good. They're going to be starting daycare and going to school. And I just feel like I'm getting on a road to normal life. I'm appreciative beyond words.
Every child is your child, and every child here needs your help. And every dollar, every gift, every pack of diapers, everything that comes here is filled with love. We pass it on, and we need that support to continue to be here for children.
We as police officers are committed to places like Providence House because we know those kids there, they're our future. And we see so much hurt in the street that we would like to do everything that we can to make sure that some of them are safe.
We have great support from the community, and we have plans to help more and more children, more and more people in need in the community. And until that need goes away, there's going to be a need for Providence House.
There aren't words to say what they do for this community or these kids and making them feel safe and wanted and loved every single day. The people who work here and care for these kids are bar none miracle workers.
If we can impact 200 children's lives a year here and save $10 million in one community, imagine what we could do in communities across the United States where we could do the same thing for other children and families.